she struggled daily with like any food that she would put into her body. She would have like severe reactions to it. She would throw up. She struggled, and we did an evaluation of her spine. We did this check. We ended up finding that she had stress on the vagus nerve. We got the stress off. Long story short, within a couple months, she ended up being able to like eat food again, like normal food again. A lot of the pain that she had in her body, like the aches, the pains, everything, it started to decrease. Her, even like her blood work, you know, like you do the allergy test and you find what you're allergic to. Has anybody ever done one of those tests? Mm-hmm. Ever done that and you're allergic to like everything?
Yes.
Yeah. This was her. Like everything was red, right? Like she's just completely allergic to everything. And you know, you can see it when she was struggling, and she just completely turned a corner. She was able to like start eating normal food again. She didn't have like as much inflammation in her body. Like a lot of the swelling went away. She stopped like throwing up when she would eat. And that girl, that was actually Jordan.
Oh wow, Jordan.
The one that just set up the camera.
Oh man.
She would be in the middle of seminars that we would go to in Atlanta, and she couldn't hold down the food that she ate, and she'd have to go to the bathroom, and she'd be here and she'd be in the bathroom because she just couldn't do it. And she came so far from. She changed definitely lifestyle habits, and she worked on a lot. It wasn't just getting adjusted, but with the changes that she had, she was able to like have some normalcy back in her life. So the stuff that we teach you, this is not just like do this and we don't do it. Like everything that we teach you, these are things that we do every day, and we try to teach these things to you because we want you to understand what we're doing to be healthy. Is that fair? Mm-hmm. So I'll never tell you to do or eat something that is not something that I've tried before, or something that I've done before. Is that fair? So when you think of inflammation, what do you think of? Swelling. Pain. Yeah. What else? Okay. Most people think of swelling and pain, right? Viruses. Now we're getting deep. So, what is inflammation, right? And what does it affect? Because if most people's understanding of inflammation is swelling, pain, we're not really understanding what it is and what it's doing to our body. And I think that's where the hang up is. Because if you really knew what inflammation affected in your body, you would do everything in your power to minimize it as much as possible, as fast as possible. And you'd be like, this is one of the primary things I need to focus on for my health. So that is why we wanted to do this workshop. And because somebody actually requested it, they asked if we would do a workshop on inflammation, and now we were doing a workshop on inflammation. So if there is ever anything that you want to learn, let us know, because I'm not just going to tell one person to do a whole workshop on it. Is that fair?
Okay.
Cool. So when you think of inflammation, you think of swelling and pain. Inflammation can run through literally your entire body. Okay. Not just your joints, right? Because when you think of inflammation, you're thinking of like joint swelling, pain. That's not the only thing that it affects. And there's two different types, right? There's just like acute inflammation where you have like, I don't know, like you hit your elbow and your elbow swells up and it's inflamed, right? Mm-hmm. That's like a normal response, because then your body sends blood vessels to that area. Say like you broke a bone, and then that bone needs to heal. Your body will send a normal response to that. It'll send inflammation to that area. That way you get more blood vessels, you get the information there that needs to go there, and all the different types of cells that'll clean up the area, and it'll help the bone regenerate. So is inflammation a good thing sometimes? Mm-hmm. Right?
Yes.
Acute inflammation is good. What about chronic? Mm-hmm. Is that good? chronic inflammation is really what we're talking about. That's the real problem. Chronic inflammation is sometimes it kind of like hangs under the radar because we have conditions that we think are related to something else when a lot of times it's actually just inflammation. Like if you listen to some of the smartest doctors in the world, they say every disease comes from inflammation. Have you ever heard that before?
Like cancer.
And it never made, even cancers and things, it never made sense to me until, you really dive in and see what this can affect in your body. So when you have chronic inflammation, sometimes it's even subclinical. Like it won't show up on blood tests. It won't show up in your day-to-day, but it's in there. It's in your body and it's systemic. So when it becomes systemic, it can literally start to affect organ systems in your body. Did anyone know that? That the inflammation can affect organ systems in your body.
Yeah.
It doesn't just affect joints. It can affect your heart, it can affect your brain. That was the title of the workshop. Most people didn't know that, right? It can affect your gut. It can definitely affect the joints, but it can affect literally every organ system in your entire body. It can affect the nerves, right? Inflammation is both a protector and a predator. It can affect everything in your body. Heart, organs. It can create fibrosis in organs. It can create vascular disease. I'll get back to that in a minute of how that actually creates heart disease. Neurodegenerative diseases because the inflammation goes to the brain. Autoimmune can be caused because of gut issues. And then even cancers can result as from too much inflammation in your body. And it does start a lot of times with just bad habits. Does that make sense? Yeah. If you just sit around all day and you don't really do that much, do you think that could start inflammation in your body? If you make the wrong choices in the things that we're eating, if we're not eating the drink or eating the right food, if we're not drinking the proper amount of water, does that inflame your body?
Yes.
Right? So it is a lot of these things, they are choices. And all of you are at different levels in your understanding. So you have to understand that as I go through this. Some of you have master's degrees in this stuff. Some of you don't. Some of you don't have the background that others do. So I have to tailor this talk to everybody so that way everybody can understand what I'm talking about and then they can take an action step and do something different. So for the people that know everything, maybe there's one or two things you're going to grab from this and you're going to take home and you're going to be like, I'm going to do those two things. But whenever I do these workshops, I do ask that you change something. Because if I stand up here and I do this talk for 6 hours and I'm just kidding, it's not 6 hours. If I do this talk for 45 minutes, an hour, if I get tied up, and you do nothing different, what was the point of sitting here? Was there a point to sit here? Just to get more information? You can get information off Google. You can get information off TikTok, and Instagram, right? You don't need more information. You need to do something different. Is that fair? So part of my job is to get you to do something different, to walk more, right?
You're looking at me?
I was looking at somebody, but I'm not going to say who.
I must feel.
Because that's our job. It's to hold you accountable to the things that you want to do and the lifestyle choices, the goals that you have to make sure that you're doing the right thing for yourself. Is that fair? And just getting adjusted alone, while it's great, it's not everything. Is that fair?
Mm-hmm.
Cool. So we talk about like poor nutrition. I'll get into some of this, but a lot of the sugars are a big part of why we have the inflammation in our diet. Just to go on like an extreme example, like one of the reasons that smoking is bad for you is, there's a bunch of chemicals and everything now. It's not just tobacco anymore, but if you smoke the tobacco, it actually, what happens when the smoke enters your lungs, what happens is these oxidative bonds. Have you ever heard those? Or oxidative stresses? It's like these molecules of oxygen that are pulled off of something, like tobacco, and it binds to anything that it wants. It can literally bind to whatever. It can bind to DNA. It can bind to anything that it chooses, and then it can alter things. It can alter your DNA, which is where cancer comes from. So that's how you would get cancer from smoking or eating McDonald's. Like if you have oil that you repetitively cook over and over and over again, and you don't change out that oil, and you run like hundreds of rounds of food through that in a day, that oxidative stress, that oil being cooked over and over and over again, that's what creates the oxidative stresses, which can bind to your DNA, which can give you cancer and diseases. So oxidative stresses, they're in the environment, they're in the air, you can't really get away from all of them. Good thing your body has its own protective mechanism and knows how to fix most of that. It's called DNA polymerase, if you're wondering. I'm sure you weren't. And it'll scan your DNA and it'll fix it. But if you have too much oxidative stress, that's when your body can't handle it anymore. Does that make sense?
Yeah.
I don't want to go too sciencey. I want to make sure you guys are staying with. So, sedentary lifestyle, just not moving your body the way that it's meant to, and just, do you need sleep? Like you have to sleep. Your cortisol levels, anybody ever heard of cortisol levels, the stress hormone? It runs on this thing, it's called a positive feedback loop. Do you know what a positive feedback loop is? Does anyone know a negative feedback loop? An example? Air conditioning. Air conditioning is a negative feedback loop. So it gets too hot and it shuts off. It gets too cold, if it gets too hot, it turns on. If it gets too cold, it shuts off. So it'll regulate itself, right, at a specific temperature. Cortisol works. You get cortisol and it's in here, and then your body's like, oh, cortisol, let's get more and more and more and more and more, and it builds, and then the only way that it stops is when you sleep. So if you're not getting restful sleep, you don't get a reset on the cortisol. So we need to make sure we're getting proper sleep. That's one of the most important things.
Can you get too much sleep?
Yes.
Okay.
What's that? Yeah. So,
How much is too much?
I know that there have been studies on this. I didn't have this prepared because I didn't know I was going to get this question. The exact number, I'm not positive. I do know that women do require more sleep than men. My wife always told me that, and I thought it was just her wanting to sleep in. You're already here. But no, there was research done on it, and women do require a little bit more. Anything below 6 for men is just like not enough. Anything below 6, you're in a deficit. 8 would be borderline for men of like, if you're going past 8, that's probably too much. Women probably need close to that 8 mark from what I remember from the research. That can go up to 10 from what I remember from the research. Don't quote me on the 10, but I know at least around that 8 mark is usually really, really good for females. All right? Does that answer a little bit? Okay. But under 6 is definitely, you don't want to go under 6 because your body's going to be trying to catch up all the time. So when you have all these stresses, it's going to affect your body in some kind of way. Does that make sense? One of the first things that's going to affect and what inflammation starts to affect is the gut. And I know I talk about the gut a lot, but it's really important. I know I talk about the nervous system a lot, but it's really important. And if you have too much inflammation in your body, you're going to stress the gut, you're going to stress the gut lining. Has anybody ever heard of leaky gut?
Mm-hmm.
Can you raise your hands? Everybody? If you have a hand. Pick up your hand if you have a hand. Okay. If your hand's up, you have leaky gut. All of you have leaky gut. And just to throw that out there. Because everybody always wonders if they have it, you have to have it. Because otherwise none of the food that you ate today would go through your gut. it would never go through the tract. It would just be like a sealed tube, and it would just go in one end and go out the other, and then nothing would be absorbed. So you have to have some permeations in there, but it's when the permeations get too big, that's when it's a problem. So that's like a pathological leaky gut. It's the holes are too big, and inflammation from the poor food and the drugs and the stress and all the poor lifestyle choices, those bombard the gut. It'll create damage to it, and these spacings through there, the things can leak through that aren't supposed to get through. Viruses and somebody said viruses. Viruses and bacteria, which can cause more inflammation and more problems. Bacteria can get through that's not supposed to get through, and it gets into your bloodstream. And now it's in your bloodstream, and that triggers inflammation. Does that make sense?
Mm-hmm.
And your body at times will start to attack the things that are coming through, and it stimulates this like immune response to it. And if the things that are coming through look similar to any part of your body, then your immune system now starts to attack those parts of your body. That's what autoimmune disease is. If it's in your bloodstream, it can go, where can it go? Everywhere.
Yeah.
Can you go to your brain?
Of course.
Can you go to your heart?
Yes, definitely.
Where is it going to go? I don't know.
Everywhere.
Nobody knows. It could go everywhere. It might just pick like one organ system and then it'll attack that. Does that make sense? So it's difficult. Do you see why this is a difficult thing to first off, to diagnose, and a very difficult thing to treat? Because it's like, if it's from inflammation and it goes to your heart and you have heart issues, you might just think you have heart issues, right? But maybe the actual root cause is coming from the inflammation. And you gotta look, where does that inflammation come from? Is it coming from the gut? Is it coming from the poor lifestyle choices? What's creating the gut issues? And then how do you remedy this? So we're gonna talk a little bit about that. So you have the gut, and then has anybody ever heard that nerve? You can tell me you have, because we talk about it all the time.
Yes.
We talk about it every time you're here, probably. It's vagus nerve, right? So you have this nerve that is connected to the gut, and what happens is, first off, if this is all inflamed, it'll irritate that nerve, and then that can go up to the brain. And then you have, in your body, you have all this bacteria, right? So you have the gut, and the gut's lined with bacteria. You have bacteria all over your body. You're outnumbered. You're mostly bacteria. For every cell in your body, there's 10 bacterial cells. You're actually just like a walking bacterial colony.
Yes, I've heard that.
That's real. So there's bacteria all over your body, but what happens is when this gets disrupted, that system, what happens is the bad bacteria, they can take over. And a lot of us have bad bacterial takeover, and when they take over, they're really smart. Like, they've been around a really long time. They can actually crawl up, and they can go into your brain. There's one called candida. It likes sugar because it eats it, and it'll go up and it'll crawl, and it'll go to the part of your brain that makes you have cravings for sugar, and it'll go. And then you're like, really have a craving for sugar. That's candida. That's a bacterial taking over your body, hijacking your nervous system. So next time you have a craving for sugar, just know, like, you don't actually want sugar, your body's just hijacked by bacteria. Isn't that crazy? Yeah, great. So we want to work on healing this, because if we don't, that inflammation is going to leak through to the blood. That blood that runs through up to the brain is going to cause the inflammation in the brain, and it's like setting your brain on fire, slowly, painfully over decades. Sorry, but it's true. It's very slow, that process. It doesn't happen immediately, and you might feel things like brain fog or people with depression and anxiety. But later on, if that inflammation is not corrected, if that inflammatory process is not happening that's happening in the body isn't corrected, now it's leading to things like the Alzheimer's and dementia, because the brain is just it's under too much stress and it's inflamed. Does that make sense? And the mental health part of this is massive. Like, there's so many people that struggle with mental health illnesses, and a majority of them, if you have anxiety, what are you gonna get if you go to the doctor?
Pills.
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 Right? What if you have depression? What are you gonna get?
More drugs.
What does that do for inflammation?
Sure.
Makes it worse. Do you know anybody that's depressed and taking antidepressants and they're still depressed?
Yes.
Me.
When was it gonna start working? It's frustrating. It's annoying, right? It's like, God, I'm taking this thing. It's supposed to help me, and it's not. Maybe we gotta go to the root, right? We gotta go to the cause. So I just want you to understand the extent of this. Even, have you ever heard of like long COVID? Long COVID, like where people had COVID and they still have these effects from it, like way later, and they don't know why. They're still struggling. They have this brain fog and they have like numbness in their hands and all that. They're doing research. This was December last year. They found that part of the reason might be because of inflammation in the brain. That the virus got in and then created all this inflammation in the brain, and then the brain just never healed appropriately from it, and the inflammation stayed in the body. Isn't that crazy? Yeah. So it's like almost like this thing that was just like, oh, you just have long COVID. They don't. You might have inflammation in your body from the disease, and you're trying to treat the symptoms, and we're not actually addressing the cause. So if you know anybody that has this, implement the changes, or if you have this, like, please, like, start to work on some of these things that you can do to help yourself. I'll get more into what to do, but I just want you to understand the significance of this. So if you think about heart disease, what do you normally think of when you think of heart disease? What number would be high on your blood work? What do you think? Cholesterol, right?
Yeah.
Cholesterol. That's what like everybody thinks, right? Did you know cholesterol is actually good for the brain?
Yes.
Calcium.
If cholesterol dips too low, did you know that your risk for neuro disorders that goes up if your cholesterol goes too low? There's been studies where people are taking cholesterol medication. It's going so low, and they're now linking that to disorders of the brain later on in life. I'm not saying to stop taking your cholesterol medication, but I'm saying that
Monitors for the hospital.
be smart enough to do the research and make your own decisions and make the proper lifestyle choices to reduce your cholesterol. Don't just rely on a pill. Does that make sense?
Yes.
Yeah.
Where heart disease actually comes from inflammation. The inflammation, remember we said it goes through the gut. Where does it get? It gets into the blood. And the blood is housed by vessels, right? So like these tubes, they're arteries and veins and everything, right? And these tubes, when they're inflamed and they swell up and they're under stress, like chronic stress for too long, those arteries are gonna start to crack. Does that make sense? Because they just can't undergo that stress. And then that cracking of the blood vessels, it has to fill in with something to protect it, so that way like an artery doesn't crack open and then you would just bleed out. Does that make sense? So your body has this protective mechanism where it pulls plaque in, and it'll fill the cracks with the plaque, so that way your arteries don't explode, right? Or crack open, and the plaque fills in, and then we try to give people a cholesterol medication, and we treat the heart disease with other medications, and we monitor the heart, and we do. Why are we not looking at the thing that actually cracked the arteries? And we've done this for a long time. It's just still not even being taught, so people don't even know this. Do you see the extent of how this can affect everything in the body? Is that fair? This is probably a problem and something that we should address. Yeah? if you could, in your head, lock in that you are going to change something because of the importance of this for yourself. And if you could teach this stuff to your families, they're gonna learn something. They're gonna benefit from it long term. Can everybody that's gonna commit to changing something, can you raise your hand? Oh, I think we got everybody. Oh, I heard you too. Alright, thank you. I would ask at least 2 to 3. Don't pick 10. Not gonna happen. What do we do when we go to seminars? How many things do we pick?
3.
Sorry, Jordan. How many do we pick?
How many do I pick?
How many do we tell you to pick?
Like 2 or 3.
2 or 3. That's the same thing that we do when we go to a seminar. We learn something new. Like, I can't implement 10, 15, 20 new things that I've learned. I can implement like 3. So we always talk about like 3 is our magic number, but don't always shoot for 3. Like, go 2, and if you definitely have 3, pick the 3. So even if you get 2, 3 things out of this, that it was worth it. So if we want to start to heal the gut, we have to rest it. Is that fair? So your gut will heal faster than any other part of your body. It heals like your tongue heals. You ever get cut on your tongue? How long does it take to heal? Faster than other parts of your body? Right? If we keep bombarding our digestive system with food constantly, and we never give it a rest, does it ever have a chance to heal? It'd be like if you had a cut and you just kept poking it or throwing like McDonald's on it. Do you think it would ever heal? No, it would probably continue to open and probably fester. It would get gross, right? So you wouldn't want to do that, but we do that to our gut every day. Doesn't make any sense, right? We have to give our gut a chance to rest, repair, to heal itself. I'm not saying don't eat anymore. So I just want that to be 100% clear. I'm gonna give you food, like eat food. You need to eat food to survive. But has anybody ever fasted before? Just so I can get a gauge of like how many people are doing this. Okay, that's like almost half the room. That's awesome. So if you fasted before, then you know the feeling of when you do it, and it doesn't feel so great at first. And then how do you normally feel? Has anybody ever done? Let's start. 12 hours. You raise your hand if you've done 12 hours. 16, 18, 24, 36. Ooh. 72.
I thought you meant like 6.
About like 4 days. 5 days? Have you fasted for 5 days?
I like during your fight time.
6 days? So you fasted for 6 days? Have you fasted for 6 days?
Me?
Yeah.
7 days.
Wow, that's awesome.
Wow.
That's cool.
But I had longer.
Yeah, you have to. I've done 7 days too. Me and you are on the same.
How do you do it?
So I'm not saying to go fast for 7 days. If you've never had any experience with this, there's a lot of ups and downs and it's pretty miserable for 7 days, but you do feel really good after and your body starts to repair itself. So this window here, that 18 to 20 hour mark is a really good window to shoot for. Anybody ever heard of intermittent fasting? So intermittent fasting is where you just pick like a window, like a 4 to 6 hour window during the day that you eat.
That's right.
And you can get like 2,000 calories in that time, in that 4 hour window, but then you just don't eat after that. You pick a time that you start, so maybe you start at 12 and you stop at 4, or you start at 12 and you stop at 6. But I would recommend in the beginning to not go for the full 18 first. Maybe like just starting with eating from 12 to 6. So it's kind of like you skip breakfast, you have your lunch at 12, and then you can eat your dinner. You just eat it before 6, and then you just don't have like a late night snack. Is that doable? So if that's your thing that you're gonna do, that's an awesome thing to start. So nice thing that happens, you start burning fat then. Right? 12 hours HGH increases human growth hormone. Wanna get bigger? Start fasting for 12 hours, you wanna burn fat, go 16. If you do that multiple days in a row for weeks at a time, you start building muscle, you start burning fat. Getting into this, autophagy, do you know what that is?
No.
Your body starts eating cancer cells. Everybody has cancer in their body. Everybody has it. But your body eats it. It gets rid of it.
Oh,
Your body fights it off. So autophagy is where it literally like cleans out all of those systems. When you get to this 72-hour mark, which I'm not saying to do in the beginning, and if you want to do that, you can talk to me about it before you do it. But you get water and you get electrolytes in your body, and like you have what you need, like you'll survive. If there's some like crazy medical health condition, please don't do that. It's not recommended, and you would want to talk to us or a specialist before you did that. But at the 72 hours, that's when the autophagy peaks, and if you can go, there's some. I don't remember the exact number because this wasn't a fasting workshop, it was more about the inflammation, but doing this once a year reduces your chances of getting cancer by like an astronomical amount.
Just do it on Yom Kippur.
There you go. That's the way to do it. So please look at this and see what you can implement in your life. I would highly recommend the intermittent fasting. It's a really easy way to do it where you just eat for 6 hours out of the day and then you don't after that. All right?
Can you wait 1 second? I want to take a
Go ahead.
No.
Take a shot.
Are you counting sleep as
Thank
an
you.
hour?
Yeah, sleep counts. Yeah.
Okay.
Yeah.
Yeah, start at 8 p.m.
There you go. Yeah, that works. Whatever the hours are for you, that works. So once we start putting the food back in and you're starting to heal the gut, should you put a bunch of junk back in there?
Probably not.
Probably not. So this quote, I love this quote. It says that the food you eat can either be the safest and most powerful form of medicine or the slowest form of poison. I don't know if anybody saw recently there was something put out that the medical schools, they were going to lose their federal funding if they didn't start teaching nutrition in the schools. Anybody hear that?
No. Good.
Yeah, good.
Yeah.
Do you think doctors should know about nutrition?
Absolutely.
Probably.
My mom was a nutritionist.
Because food can be medicine, right?
Yeah.
Or it can be poison. I had one class in chiropractic school on medicine. It was called toxicology. Literally. The rest was on nutrition and foods and how to replenish your body and how to get your body to function normally with macronutrients and micronutrients and like getting the proper things into your body, because that just made more sense. I think. So just watch the stuff that's in boxes and bags. Just read what's on in the box or the bag. If you can't, this is the easiest way. Some lady said this to me a long time ago. I'll never forget it. She said, if you can't read it, don't eat it. It says maltodextrohydrocordone something. It probably causes cancer.
Yeah.
Right? Yeah. So just read what, if it says like, people ask me like, because this is just an easy reference to go through. People are like, what about almond milk, or what about oat milk, or what about this, or what about that? It's like, just look at the back of the thing. Yes, it says water, almonds, sea salt.
Sea salt, that's it.
Yeah.
Drink that one, not the one with the canola oil and the
What about
grapeseed.
caffeine?
I have caffeine. I drink coffee, like definitely. I drink a really high quality coffee
Okay.
that doesn't have
Caffeine
mold in
is
it.
good as long as you drink a certain kind and you drink a certain amount.
Moderation.
And it's what you put into it.
Yeah, so
That can
like
destroy.
coffee. If you want, I'll try to print these out for you guys next time. There's something if you want to look it up, like alkaline versus acidic.
Yeah.
and you can balance those two, really good for inflammation too. But like if you're gonna have coffee, you can balance it by putting honey in the coffee, because honey is very alkaline, coffee is acidic. You can get like a low acidic, or stevia is also like very alkaline. So there's different options, but you put those together and then you have like a neutral type of thing that's not going to irritate the gut, right, and cause more inflammation. So yes, I definitely. You can't tell. No, this is just how I am. Ultra processed foods like the Gatorades and stuff. Like, do I have a Gatorade once in a while? Yes. If I like have been exercising for multiple hours and I don't have access to anything else, I'll drink Gatorade. But if you can get sea salt in your water, there's one called Baja Gold sea salt that is so much better for the electrolytes and the things that you need. You can get, there's one called Element. It's LMNT.
I use that one.
A lot of athletes use that, but you can do like smaller doses of it. There's like a whole gram of sodium in that. But you can do ones that are less. So they have different options now, but packets of electrolytes, typically you're not gonna have a ton of sugar in them. Like the liquid IVs and stuff like that, they just have there's so much sugar in them.
So much sugar.
They're not that good. Elements, like one of the only ones that I know that doesn't have a ton of sugar. There's one called All Day. Those are really. There's one called Cure, I think too. They have them on Amazon. So you just look it up. Again, look at the back, and if you can't read the thing and what it says, it's probably not good for you. Is that fair?
What about coconut water? Yes.
Yeah. Coconut water is awesome. Yeah, it's
But
just like
because
such
of
a.
the sugar.
Any way that you can get like a natural form of these things, that's the way to go. That's really the way that you want to do it. So coconut water is great. Like Logan said, just watch the sugar too. So once you're replenishing these things back in your body, if you want to take a picture of this, you can. The things on the left are some of the things to avoid. The things on the right are the things to add in to your diet if you don't have them currently. This is a lot, again, to heal the gut lining, to seal it. And then I'm going to talk more about like specific anti-inflammatory foods. So, but these are things that will irritate the gut. Gluten does irritate the gut. I do get a lot of questions on this, that it can create more inflammation in your body. A lot of the times the gluten irritates your body because you already have those permeations in the gut lining, and then those particles, as they're breaking down, those pieces can leak through the gut, and then they get into the bloodstream, and then it causes inflammation. But if your gut is sealed and it's healed properly, gluten doesn't bother you as much, unless you're celiac and don't eat it because that doesn't work. So, but a lot of the problem with the gluten is actually the stuff that it's sprayed with. It's like the glyphosate, that's the issue. Because you can go to Italy, and my wife, she cannot eat any gluten here. She has a piece of bread, she's like done for the night. We could go to Italy and we can have a big bowl of pasta, and like she feels great. And we can go walk and do everything that we're gonna do for the day, and you get like skinnier. It's weird, right? Like you can eat as much pasta as you want, and you like lose weight. It's very weird.
So I
Basically,
use
we should
walk
all
here.
move to Italy.
Yeah.
Walk is the walk.
So much.
So
Do you talk about mast cell stuff at all?
I want to do that so bad.
About what?
Mast cell. I will try.
Because I
a little
have that.
bit.
I have issues
Yeah.
with that.
So I have something that I can send you on that. It's really good. We're talking about like histamine response.
Because like the fermented fat, like that.
That not good for.
Yeah.
So
That'd be a no-no.
fermented foods are fantastic. They're really beneficial. They replenish the bacteria in your body. It's really, really good. But there's a specific condition with like histamine. It's a different thing. Like you can't have it. So there are specific conditions that you just want to be cautious of some of this stuff. Like if you have a severe allergy to milk, then you don't want to get like organic raw dairy. Right? That's not going to be good for you. So just be smart with it. If you want to, when you're done with if you have like leftovers, freezing them after is really good. And a lot of like frozen things are actually better than food that's been sitting out because that builds up the histamine in it. So that was one thing that I learned recently about that. And go on ChatGPT and you can type in meal plan for mast cell activation syndrome, and it'll give you everything about like what to eat. It's really really cool, and you can create like a grocery list and everything. It's really really cool when you're able to do that. So bone broth will help seal the gut. The dairy, the fermented vegetables, dairy that's not ultra processed, that a lot of times will help replenish the gut. Like if you go to a farm and you get milk, it's very different than going to the grocery store and getting milk. Right? It's cheaper, and it actually has the good bacteria in it. Right? And a lot of times people aren't actually like allergic to milk; they're having a reaction to the ultra processing of the milk.
What about the lactose-free milk? Like lactate and Fairlight.
Look at the back. You'll see all the stuff that's in there. Yeah, I would rather you go, if you're not going to go that route, just go like almond milk or milk or coconut or something like that.
Okay.
Oat, I guess, isn't as good anymore now. Like almond and coconut is probably better for you. Coconut products. Wild caught food. Salmon is like one of the best because it's so oily. The omegas, they're really good for inflammation. So mackerel is really really good for inflammation. So wild caught is definitely the best way to go. You're gonna get more oils, and your body's gonna be able to process it better. You want to go ahead and take a picture of some of these, so that way you have the some of the vegetables. Remember we talked about it's better if you can get these things naturally, right? What's better, do you think? Taking a turmeric supplement, or like steeping your own turmeric and ginger and making a tea? What do you think is better? Tea. Does it take longer to do that?
Yes.
Yes, but
That's natural.
yeah, it's like such a better way to do it. Turmeric is a great anti-inflammatory. When the turmeric has a little bit of black pepper in it, it helps your body absorb it too. So if you're taking turmeric and you're not having a result from it, it might be because you don't have the turmeric with the black pepper in it as a supplement. So they make turmeric. Are we in Georgia? I'm from Jersey too. I learned about all these things when I was in Georgia. When I grew up in Jersey, we had like, when we were sick, we had like Camel's chicken noodle soup and ginger ale. Saltines. I learned about this all when I was in primary school. So, look at the antioxidants. Those are just, more antioxidants in your diet. Does anybody eat like a lot of fruit? Anybody eat a lot of fruit? I eat probably too much fruit. Jordan knows. I have a mango. And mangoes and blueberries. I eat a ton of blueberries. The berries are like they're just higher in antioxidants and they're lower in the sugar. Berries are the best way to go. Just don't watch any videos on strawberries. Never mind. Blackberries and raspberries and all the berries. Those are the best ones, and they're gonna have a lot of the antioxidants. Acai has a lot of antioxidants in there.
Yeah, they're so
acai bowl.
Acai.
So they have
Acai.
So you have so that can be loaded in sugar. So they do make ones that have less sugar. You can get them at a grocery store where they're unsweetened. It's a good way to go. What's it? Costco has it. Really?
Yeah.
You always know where all this stuff is. Like I was saying, the mackerel, the salmon, herring, they all have high omegas. So again, naturally, whenever you can get it, a couple times a week or a few times a week, you really want to implement. If you're not getting the fish, you really want to implement omegas into your diet. If you're vegan or if you're vegetarian, you can't do that. There's something called Budo's oil. Can we know about that? If you're vegan or vegetarian, it's like a good way to get the oils without having to get the fish. All right. Beans probably not as good. Okay. So supplements that I wanted to talk about. So the omegas, those are really good. If you made one change tonight and you're not taking omegas, that would be one of the ones. Has anybody picked something that they're gonna do?
Yes.
Yeah.
If you pick something that you're gonna do, just so that way I know, so I have to like.
Yes.
Anybody gonna change something? Yet?
Yes.
Did they give you anything yet that you can change? No? Alright, I got like half your notes. So everybody else will work on. Maybe there's something that I can find. So, how many people are taking omegas? Awesome, that's great. Maybe you guys don't need to change anything. You guys, CoQ10 has been linked to the anti-inflammatory. Bromelain, you know how they cut the core out of the pineapple and then they throw that part away? That core is loaded with bromelain. Like if you like pineapple, you can get the pineapple and you can get the core and you can like chew on the core. And if you chew on the core, you get a ton of bromelain. Does anybody have joint pain?
Yeah, they told me when I was
Anybody have
pregnant.
joint pain? I do.
When I was pregnant to eat it.
What's that?
They
When
said
you're pregnant?
when I was pregnant to
Yeah.
eat it, yeah.
Yeah, like joint pain, bromelain, like it'll help with knee pain, it'll help with back pain, like chewing on the bromelain. Yeah, everybody throws it out. Vitamin D, go out in the sun. Like, don't be too afraid of the sun. A lot of times, skin cancer comes from sunscreen, which is insane. Because it's actually just like poison on your skin that's heating up. That's not good. You can get mineral sunscreen. That's a better way to go. Right? Zinc is a great way to protect yourself. Right? Like eating carrots is a great way to protect yourself.
Also, if you go in the sun every day in the morning for like 20 minutes and don't eat seed oils, your skin will get used to the sunlight and won't burn.
Yeah, a lot of the issues with sun, one is people do it too long, or two, they never do it and they sit in a cubicle 8 hours a day. Even in Florida, they sit there and then they go on vacation once a year for a week and then they burn to a crisp and then they get melanoma because their body's not used to the sun. So if you can get, like Logan was saying, in the morning or towards the end of the day, if you can get in the sun, morning is the best way to do it. So you're just getting that blue light into your body first thing in the morning, going on a walk or something, getting that sunlight. It actually, if you can get it on your belly, the sun on your belly, that's where you'll absorb the most vitamin D. So just walk down the street with your belly You can do it. You can do it in your backyard. Or, that's what the magnesium. I just want to make sure I hit all these. So the magnesium, particularly like magnesium glycinate, that's the one that's good for inflammation if you don't already have that. Curcumin is a good one. Dandelion is really good. Dandelion has like a ton of benefits, but you can get like dandelion tea. Does anybody ever drink dandelion tea? Yeah, it's pretty good too. You can put honey in your dandelion tea if you don't like honey, nothing else. So resveratrol, this has been known to fight cancer, and then the other part of that is you gotta start moving our bodies. Is that fair?
Yeah.
You can do all that other stuff and just sit around and you're gonna still gonna have problems here. So if you can't exercise, can you breathe? Can you at least like take a deep breath? Is that fair? If you are not gonna do the exercise and you're not gonna move your body, Susan, can I compliment you? Susan, can I compliment you?
You want to compliment me?
Yes. How much you ride your bike?
Oh, yeah, sure, go ahead.
You come here on your, how many miles do you ride to get
Well,
here?
I don't live that far away, but
How far?
I have traveled on my tricycle.
Yep.
Not my bicycle, my tricycle, quite a few miles at various times if I have to get to certain places.
I think you used to come to the old office when we were there,
Yeah.
and you would ride miles to come there a couple times a week.
I don't.
And to the market up the street too.
Oh, that one, yes.
That one too.
Yes.
And can you share, just so that way everybody realizes they can do it, can you share how old you are? Can you share how
Yes,
old you are?
sure. I, at the moment, I'm 86. In
Isn't that amazing?
3.5 weeks, I'll be
Can
87.
we give a round of applause? How cool is that? I want to be riding that. I want to be doing that when I'm 86. Isn't that amazing?
So does she come in just for like touch-ups? Or
Isn't
do you
that?
come in for just like little aches and pains?
Yeah, I do have, well, arthritis.
We don't have to talk about it.
Oh.
Now we're getting deep. But I'm proud of you for like what you do, and I hope I'm like inspired to exercise and move as much as you do when I get there. So it's amazing that you do
It's
that.
easier for me to ride my tricycle than it is for me to walk.
Yeah, and that's so find your thing, right? Because walking very far, it's hard on the joints. Riding the bike, it's easier because it's not as much stress on your joints. Right? And that was really smart to figure that out instead of saying like, oh, I can't exercise anymore, right? And making it a normal part of life. If you can't ride the tricycle, if you can't ride a bike, can you breathe? Yes, you can breathe. So taking deep breaths every day, like 10, even if you were to just do 10 deep breaths every day and do 3 sets of it, what's going to happen is you're going to get your lymphatic system pumping. So when you do vigorous exercise, one of the most beneficial parts of that is that you actually are getting your lymphatic system to pump, which is taking the toxins out of your body. So if you're not exercising currently, please take 10 deep, like belly breaths every day to just expand your lungs and move your body. And you can YouTube, you can research, there's advanced breathing exercises that you can do. Just at the minimum, let's work on that. There's grounding. Has anybody ever heard of these? Like you can buy these mats now that attach to your bed and you like hook it up into the ground.
Oh, yes.
Yes.
Are those good? Like the sheets and.
I guess like just go walk outside though.
I know. That's
Like
what
just
I say.
go barefoot and walk out in the grass.
But I hear about it and I wonder.
I know, I wonder too. There's like these really expensive mats and you can lay on them in your bed and they connect to the ground. I'm sure they're really, really good. There's people that are like grounded all the time and they have, I don't know, goes pretty far. But please, once in a while, take off your shoes and go walk in some grass or go walk in some dirt or
The
go
beach is the best
go walk
place
on the
for that.
beach and like re-ground yourself because there is actually electricity in your body. Did you know that?
Yes.
If you say disconnected from the earth your entire life, do you think that could create a problem? Right? That's not some far off, crazy, mystical thing. It's just like you have electricity in your body. You should probably just once in a while touch into it.
Plug it
Ground.
in.
Plug it in for like a second. Right? You're running on empty. You're like, I can't do this anymore. Just plug in for like a second. Alright? If you don't go barefoot,
Oh, it
please
really
take
helps
that.
with the inflammation because when I don't feel good, I go outside and do that and immediately my headaches would stop.
Yeah.
It helps so much, especially when you're nauseous.
Yeah, it means a lot, you saying that, from like all the stuff that you do.
Yeah.
Infrared sauna. So sauna is a great way to fight inflammation. It's a great way to fight cardiovascular disease. You lower, even just like 3 times a week at 20 minutes, if you have access to a sauna, like you're gonna lower your risk of cardiovascular disease by an astronomical amount.
They make them cold.
They make you cold. The infrared. I think they actually do make like infrared saunas that don't get hot.
That would be amazing.
don't know if they're not as beneficial, definitely.
Oh.
There's sleep, like we talked about. If you like cold, which I know you want, actually like a cold plunge
Yeah, I
is
guess.
awesome.
Yeah, I should do cold plunges.
Yeah, it helps with
So
your
far,
cell
okay.
regeneration.
Yeah.
It helps
So
heal.
I found a freezer in my neighborhood, and I redid a freezer and like sealed it and made it function for cold plunge, and now I have a cold plunge in my backyard.
Nice.
Smart.
If you want to get that creative, like you can, there are ways of doing it where you can just get like ice and I'm not saying to do the cold plunge, but like you could get ice and you could put it in a big bowl of water and you can put your face in it. And it
Yeah.
resets the vagus nerve, it resets your body, and it does help a lot. Doing it in the mornings can help. Cold plunge is
Or just turn on the shower
Yeah,
to
cold.
cold.
yeah, you
or
go
the
shower
hot.
cold.
Yeah.
Some people go like really cold in the cold plunges. They go to like 37 degrees. Like I don't personally like that. I thought I would. I thought it was gonna be really cool, and it just hurt. Like my body hurt. And I was like, I'm not enjoying this.
What about cryotherapy?
Cryotherapy is like another way to just decrease inflammation in your body, but around that like 50 mark, 50 to 55, 57, like that's a good mark to hit if you ever have access to a cold plunge. There's places that do that now where you can just go there and get the sauna and the cold
I
plunge.
just want to say in the Scandinavian countries, it's a regular thing to take
Yeah.
a bath or shower and then go roll in the snow
Yeah.
afterwards. Yeah.
Yeah, a lot of the kids do that too. And it fights like it boosts their immune function and everything. So, but yeah, you go in there and you feel like you're gonna die. And then you get out and you didn't die. And that whole like fight or flight, chronic fight or flight inflammatory response that your body's having, you don't have that anymore because you went through an acute stress, you went through like an acute inflammatory process, and now it's over and your body gets to relax. So that could be vigorous exercise. Has anyone ever heard of rebounder?
I have one.
You have one?
With the wobble
Of course
thing?
I do.
The wobble
You can-
tables?
It's actually like a little trampoline.
Oh.
And they make one with handles on it so you can hold it in the house. And you could literally just, you don't have to jump up in the air, but you can literally just bounce lightly up and down. And that'll pump the lymphatics in your body, it'll get your blood flowing, it'll reduce inflammation in your body. So
What
if
about
you're
vibration plates?
yeah, they work a lot of the same and they help pump the
What about that
inflammation.
along with chiropractic? You
The
know?
vibration? Yeah, I mean with any.
I mean, it's not gonna.
No, it wouldn't hurt you. No, it'd be good. You can actually work on, if you're got a biplate, you can actually work on your extension exercises while you're on the biplate, and it'll help promote the curvature in your neck.
All right.
So that works. Meditation, that's a great way to go. But, and then there was one on there, I left this picture just kind of as a joke, but I was saying you could, and then you can actually stimulate the vagus nerve is one of the ways that you can actually decrease the inflammation in the body and restore some of the normal functions of your body. And they make these little vagus nerve stimulators now where they like zap your
Oh yeah, I've got
vagus
it
nerve.
on Dr. Laura.
And I was just thinking when I put this slide together, because I was like, I'm going to change that for Atlas so that way I can tell people what we do. But I was like, I might as well leave it. And so you can do that, or you can just get like the most specific adjustment on the planet and get three-dimensional X-rays, computer analyzed to 100th of a degree, and have 6 doctors study them and figure out how to place that thing in the right place and take the stress off of the nerve and do post-film so you can actually see that the stress was removed and do that instead of just like zapping it. So if you're already doing that, I'm glad that you're getting adjusted. If you're not and you want to, you can talk to
Well,
me
you guys don't
after.
live
Or
with
you
us.
can hum.
What's that?
So you guys don't live with us.
Yeah.
You can humming stimulates the vagus.
Yeah,
Oh, yeah,
humming
humming
too.
is really
Yeah,
good.
yeah. So, did everybody get like one thing that they're gonna change, please? Yes.
Please, yeah.
Okay, at least one thing. Some 2, some 3. please implement some kind of change, right? And if there was anything that I missed or anything that you wanted more than that, you are welcome to ask Dr. A next time you're here. No, I'm kidding. I'm here. I can answer anything that you guys want. I'm not going to answer like group questions because I want to be respectful of everybody's time. I think I'm already 1 minute over. So I appreciate you guys, and I hope that you make some changes and it helps your body. Share it with your families, please, so that way they can make the changes as well. But thank you guys.